If I now turn to care homes, the number of people dying in care homes is also falling. Figures from the CQC show that there's a 79% fall from the peak of the crisis in care homes, the week ending April the 24th, to the week ending the 29th of May, the latest when the data is available. And the latest ONS data show that there were 12,739 registered deaths in care homes in the year up to the 22nd of May, and this represents 29.1% of all registered COVID deaths. From the earliest days of this crisis, we recognised that people in social care were uniquely vulnerable. 2/3 of people in residential care are over the age of 85. And the latest data from Public Health England show that the over 80s are 70 times more likely to die from coronavirus than the under 40s. So I know personally what an anxious time it is, and it has been, for anyone with a loved one in social care. Last month, I announced that all residents and staff of elderly care homes in England would receive a test by early June, regardless of whether they had symptoms or not. And I want to thank my team and those colleagues in social care who've delivered that target on time on Saturday. We've now sent over 1 million test kits to almost 9,000 elderly care homes. And the care homes themselves ask that they have the flexibility to do the test when it works for them. And the good news is that the test results so far do not show a significant rise in the number of positive cases, despite going through and testing all of the residents and staff. Throughout the crisis, we've been rapidly testing any care home with an outbreak or any care home resident or staff member with symptoms. And as we built up testing capacity, we prioritised testing of care homes for the elderly, making sure that every resident and staff member could be tested, whether or not they had symptoms. And the reason we did this is because the evidence shows that age is by far the greatest risk factor. We'll now make sure that we do all of this in working age care homes as well. So I can announce that from today, all remaining adult care homes in England will be able to order the whole care home testing service for residents and staff. This service will benefit residents and staff in over 6,000 more care homes. It'll mean that right across adult social care, everyone will have the certainty and confidence of a high-quality coronavirus test, whether symptomatic or not. Certainty about whether or not they're carrying the virus, and confidence that they're doing the right thing both to protect themselves and others.